Hi, my name is Joseph Cooper, and this presentation is entitled Breaking the Cycle, Type 2 Diabetes in the African American Community. I'm a student at the University of Arizona working on my BA in psychology, and this is my signature assignment in the upper tier nutrition course NSC 310. And we are here to explore a serious issue affecting our communities. I researched trusted sources like CDC, NIH, and American Diabetes Association. I also bring a personal connection. Diabetes has affected my family. I'm passionate about making health information accessible and practical. So imagine being diagnosed with a preventable disease in your 30s, a disease that could change your life forever, not because you didn't care, but because you were never given the tools or support to prevent it. This presentation is about type 2 diabetes mellitus and how it disproportionately affects Black American communities. I'll explain what the disease is, why it matters, and what we can do as individuals, as a community, and within our healthcare system. We're going to briefly explore how long-standing social and economic barriers have shaped health outcomes in Black communities. We'll break down what type 2 diabetes is, how it disproportionately affects Black Americans, and why that connection exists. Finally, we'll look at what individuals can do and highlight community and national level changes needed to reduce these disparities. Slide 2, historical and social determinants of health. Let's consider the historical and social determinants of health, the condition in which people are born, grow, live, work, and age, and the structures shaped by what has come to be called systemic racism in policy. Food deserts. More than geography, areas lacking affordable, nutritious food often result from redlining and disinvestment. But we know food alone isn't the only problem. The PLOS medicine paper, Moving Beyond Food Deserts, emphasizes we need child care support, school nutrition programs, expanded food assistance, and taxes on unhealthy food. These are crucial levers to reshape environments. Alongside this, economic instability, segregated housing, and limitations in healthcare access have persisted across generations, putting Black Americans at greater risk of chronic stressors and have contributed to diseases like type 2 diabetes. What is type 2 diabetes? Now, what is it exactly? It's a chronic metabolic disorder where the body becomes resistant to insulin or doesn't produce enough of it. Insulin is a hormone made by the pancreas that helps your body move sugar from your blood into your cells for energy. When this system breaks down, blood sugar levels rise. T2DM, for short, is different from type 1 diabetes, which is an autoimmune disease where the body attacks its own insulin-producing cells in the pancreas. Type 1 usually shows up earlier in life and requires lifelong insulin therapy. Type 2, by contrast, is often linked to diet, lifestyle, and genetics, and it develops gradually. In T2DM, several organs are impacted. The pancreas tries to keep up with insulin demand, but over time may stop producing enough. The liver begins to release too much glucose into the blood, worsening high sugar levels. The kidneys work overtime to filter out the excess sugar, which can lead to water loss, dehydration, and eventually kidney damage. They also help balance electrolytes like sodium and potassium, which can be thrown off in unmanaged diabetes. Common signs include elevated blood glucose, frequent infections, and slow wound healing. Symptoms people may feel include fatigue, excessive thirst, blurred vision, and tingling or numbness in the hands and feet. If left untreated, T2DM can lead to serious complications, heart disease, kidney failure, blindness, and even amputations. Not surprisingly, Black Americans experience these at higher rates as well. However, with proper care and early intervention, especially lifestyle changes, many people live full lives with this condition. Epidemiological data. Let's connect race with diabetes data. According to the CDC's National Diabetes Statistic Report, 17.4% of non-Hispanic Black adults have diabetes, compared to 13.6% of non-Hispanic whites, a 1.28-fold difference. Furthermore, the HHS Office of Minority Health reports a 1.8 to 1 ratio of diagnosis in Black Americans versus white Americans, and Black Americans are twice as likely to die from diabetes complications. Studies show that while complication rates have improved overall, disparities remain. Black and Hispanic people still experience higher complication rates. This means that African Americans with diabetes are more likely to suffer amputations due to poor circulation, develop kidney failure, and face more hospitalizations for preventable diabetes-related emergencies. These complications are not just biological, they're social, economic, and historical. These inequities are rooted in systemic racism in housing, employment, schools, and healthcare. Discriminatory practices, including hiring and mortgage bias, limit opportunity and perpetuate economic disadvantage. There is also a factor of medical mistrust and historical mistreatment, such as the Tuskegee syphilis study, which have made many African Americans wary of seeking medical help, which worsens outcomes. Connie's story. I spoke with a friend for church, a mature Black lady, who shared her lived experience. She said that through intentional learning and self-education, she's maintained her health. Growing up, she was taught by her family to appreciate her vegetables, and as a child, she consumed a fair amount of sugar, but she remained highly active outdoors. Today, she observes young people are often sedentary, glued to phones, leading to early onset diabetes. She also noted ongoing poverty as a contributing factor for health outcomes, and that diabetes has impacted her own family. Her story, blending personal resilience and systemic obstacles, showed me how environment and behavior together shape health outcomes. I was happy to speak with her before doing this assignment because culturally relevant wisdom matters, and her words echo the data. For me, this was where anecdote meets science. What individuals can do. Here are steps you can take today. Cut added sugar. Swap soda for water with lemon or herbs or various fruit infusions. Read labels. Be aware of serving size and sugar content. Plan smart. Buy frozen produce, beans, rice, bulk staples. Check USDA SNAP-Ed budgeting tools. Stay active. Aim for 30 minutes of daily movement. Remember, obesity raises both risk and severity of diabetes. Learn from Japan. Smaller proportions, less sugar, and lower obesity correlate with better health, and T2DM is strongly associated with obesity. If diabetes is in your family, these are practical, powerful prevention tools, emphasizing acting early and consistently. Also, you could ask neighbors in your community for other ideas. All of these little things add up to big benefits. Community and systemic change. Individual efforts succeed when supported by wider community and policy efforts. Community programs, establish urban farms, farmers markets, mobile grocery units, cooking demos, and medical screenings at local churches or community centers, they're all important. We can do more financial incentives too. I want to highlight that programs like SNAP, WIC, and Super SNAP increase produce purchases. Evidence shows that $24 more spent monthly on fruits and vegetables per household. Policy actions. Produce subsidies are helpful. To reduce food cost barriers, sugary drink taxes can be done too, shown to reduce consumption, very successful. School-based nutrition education to instill healthy habits. Medicaid, Medicare coverage for diabetes prevention programs is very important. By reshaping systemic incentives, we can make healthy choices easier across communities. To recap, we discussed historical barriers, food deserts, racism, and limited healthcare. that increased diabetes risk in Black communities. We clarified what type 2 diabetes is and how it affects the body. We presented national data showing significant disparities affecting Black Americans. We offered actionable steps individuals can take to manage or prevent diabetes. And we discussed community and policy strategies needed for large-scale change. In conclusion, type 2 diabetes in Black Americans is also a social justice issue, not just a health issue. When we combine personal action with community and systemic solutions, we build a healthier, more equitable future. Thank you for going on this journey with me and for being part of the change by caring for yourself, your family, and your community. Be well.